Thank you very much, and good afternoon, everyone. I'm very pleased to be making this announcement today with my colleagues, Harjit Sajjan, the Minister of National Defence, and Minister Pablo Rodriguez, Leader of the Government in the House of Commons, as well as Mr. Conrad Sauvé, the President and CEO of the Canadian Red Cross. Canadians have always relied on the Canadian Red Cross and its volunteers during difficult times, and the ongoing COVID-19 pandemic has certainly presented unique challenges. From the outset, the Red Cross jumped into action and has played an important role in Canada's response to the pandemic. And as it has done throughout its history, the Red Cross is providing vital help to those that need it most. The Government of Canada is enormously grateful for its dedication and support, and I know that all Canadians will join me in expressing our gratitude to Mr. Sauvé and the Red Cross for their help. I'd like to also personally thank them and all of their volunteers for everything that they do. Since the start of COVID-19, the Red Cross has helped support vulnerable people by distributing emergency supplies such as cots, blankets, and hygiene kits in communities right across Canada. The Red Cross has provided a health clinic to support returning Canadians quarantined at CFB Trenton and the NAV Centre in Cornwall. And on behalf of several provincial governments, it has provided mental health support, information, referrals, and friendly calls to people in self-isolation. The Red Cross has also stepped up to help one of our hardest-hit populations, Canadians living in long-term care facilities. Oversight of long-term care facilities is a provincial and territorial responsibility. But when it became clear that a tragedy was unfolding in care homes, the Government of Canada joined forces with the provinces of Ontario and Quebec to take action. And since April, medically trained members of the Canadian Armed Forces have been deployed to temporarily assist local officials at many critical long-term care homes in Quebec and Ontario. They have been providing a range of humanitarian relief assistance and medical support and making a real difference in improving the situation in those facilities. We are proud of the contributions that they have made. I'd like to thank the brave men and women of the Canadian Armed Forces who have helped stabilize the situation in many of the hardest-hit care homes throughout Canada. They've done an extraordinary job in creating a safer environment for seniors and helping protect the health and safety of all Canadians. And while the crisis has abated, help is still needed to ensure that people living in those homes remain safe. And that is why the Government of Canada is investing in the Canadian Red Cross to quickly assemble and put to work a new humanitarian workforce to complement existing health measures in facilities across Quebec. This humanitarian workforce will allow members of the Canadian Armed Forces to begin transitioning back to their normal duties while maintaining a small reserve force in place for quick response should it be required. The Red Cross recently launched a recruitment campaign for its new workforce, and it has received to date more than 2,400 applications. With the support of Health Canada and the Public Service Commission, the Red Cross is currently establishing its first cohort of personnel who will be trained and ready for work as of July the 6th. And by the end of July, the Red Cross aims to have recruited and trained a total of 900 people to provide supporting facilities across Quebec with a focus on those facilities with the highest outbreak needs. They are expected to be in place until September the 15th, and that's when the province's own recruitment and training efforts are expected to be completed, and the first deployment of new permanent staff will be in place. The Red Cross's humanitarian workforce is being funded in part by the up to $100 million in support for the Canadian Red Cross that the Prime Minister announced last month. That funding was committed to help the Red Cross meet increased demands due to COVID-19 and to support future emergency relief efforts. In any emergency situation, the Red Cross is always among the first to lend a helping hand to people in need. And we've seen it happen time and time again when disaster strikes. We see it again today in response to the COVID-19 pandemic. I'd like to take the opportunity to once again thank the Canadian Armed Forces for their incredible work to help bring long-term care homes out of a crisis situation. And thanks as well to the Canadian Red Cross for stepping forward to build on that work and to keep Canadians safe. Canadians working together can take care of any challenge, and this collaboration is yet another example of that. And while provinces and territories are opening up, COVID-19 remains a serious concern, and the response to the pandemic will continue to rely on all of us to do our parts. We will continue to do everything we can to keep Canadians healthy and safe. Thank you.
Merci beaucoup, Bill. Thank you, Bill. Bonjour tout le monde. La pandémie s'est attaquée aux personnes les plus vulnérables de notre société, à nos personnes âgées. Ensemble, on doit faire tout ce qui est possible pour les protéger. La santé et la sécurité de nos aînés a toujours été notre priorité. Ça va continuer de l'être et enfin, ça sera toujours ainsi. Et c'est pour ça qu'on a tout de suite répondu présent quand Québec et l'Ontario nous ont demandé un coup de pouce. Et depuis avril, des soldats sont sur le terrain dans plusieurs CHSLD. Ils ont été au chevet de nos aînés dans les meilleurs moments comme dans les pires. Ils leur ont fourni toute l'aide dont ils avaient besoin. Et je suis extrêmement fier, nous sommes extrêmement fiers de leur travail. Et je veux prendre le temps de les remercier. Vous savez, c'est parfois en temps de crise qu'on comprend le plus la valeur et l'importance des Forces armées canadiennes. Vous avez été là pour nos mères, nos pères, nos grands-parents. Et merci du fond du cœur. Et aujourd'hui, même si la crise s'atténue, le gouvernement du Québec nous a demandé un coup de pouce jusqu'en septembre prochain, et ça va donner le temps à Québec de former du personnel qui va pouvoir assurer des services dans l'ensemble du réseau. Et je tiens à rassurer les Québécois, on répond de façon positive, on répond positivement à cette demande. On dit oui, évidemment, on va être là pour nos aînés. On s'engage à soutenir Québec jusqu'à ce que le personnel formé puisse débuter en CHSLD à la mi-septembre. On avait dit qu'on laisserait tomber personne. Et c'est le cas, on est là pour nos personnes âgées dans les CHSLD. On tient nos promesses. Et à court terme, nos militaires restent présents dans plusieurs CHSLD jusqu'à temps que la situation se stabilise. Et en parallèle, la transition se fait vers la Croix-Rouge. Au cours des dernières semaines, on a travaillé avec Québec sur un plan de transition qui nous permet de transférer les opérations en cours pour passer du personnel militaire à du personnel civil. Et c'est maintenant possible grâce à l'aide et au travail de la Croix-Rouge canadienne. Ainsi, la Croix-Rouge, avec le soutien du gouvernement du Canada, va pouvoir déployer une nouvelle force humanitaire pour épauler nos anges gardiens qui sont déjà dans ces établissements. Et en parallèle, des équipes des Forces armées resteront disponibles si la situation devenait critique afin d'assurer une réponse rapide et urgente. Les Canadiens ont toujours été capables de se fier à la Croix-Rouge canadienne pendant des périodes difficiles. Et depuis le début de la pandémie, la Croix-Rouge a été essentielle dans nos interventions. Elle a aidé les Canadiens dans les sites en quarantaine avec son hôpital mobile. Elle a aidé d'autres Québécois et Canadiens qui vivent dans les CHSLD. Et avec le soutien de Santé Canada et de la Commission de la santé publique, la Croix-Rouge prépare actuellement sa première cohorte de personnel. 150 personnes seront formées et prêtes pour le travail à partir du 6 juillet. D'ici la fin du mois de juillet, la Croix-Rouge recrutera et formera un total de 900 personnes pour venir en aide à nos aînés et les efforts seront axés sur les centres ayant les plus grands besoins. Ils seront en place jusqu'au 15 septembre, c'est-à-dire selon la demande de Québec. À ce moment, les efforts de recrutement et de formation du Québec devraient être terminés donc autour du 15 septembre. Le mois dernier, le premier ministre a annoncé une aide de 100 millions de dollars à la Croix-Rouge et cette enveloppe servira à financer l'intervention de la Croix-Rouge au Québec. La pandémie, on le sait, est encore bien réelle. Elle n'est pas finie et elle nécessite un travail d'équipe, elle nécessite de la collaboration et on va continuer d'être là pour les Québécois, pour les Canadiens, avec l'aide de la Croix-Rouge en intervenant concrètement, directement, de façon durable, là où on en a le plus besoin. Et on va tout faire en notre pouvoir pour protéger la santé et la sécurité de nos aînés. On leur doit bien ça et bien plus. Merci.
Merci, Pablo and Bill. Good afternoon. Bonjour à tous. In our most difficult moments, Canadians rely on our military for help. No matter the risk, the Canadian Armed Forces have always been ready to answer the call. And as always, our people in uniform were ready to respond to the needs of Canadians during this pandemic. Since January of this year, our military has been a critical part of Canada's response to COVID-19. They helped to bring some hundreds of Canadians from abroad providing them with a safe place to stay while in quarantine. Our Canadian Rangers supported our northern, Indigenous, and remote communities, assisting their leaders with planning, setting up triage centers, and delivering food and supplies. Our military members also has assisted with contact tracing and coordinating the movement of medical equipment and material so that Canadians have access to these critical resources when and where it is needed. And since April, our Canadian Armed Forces members work day and night to keep our parents and grandparents safe. They have helped our most vulnerable in 47 long-term care facilities in Quebec, and as well as 7 in Ontario. And throughout this effort, they worked alongside frontline civilian healthcare staff in their fight against COVID-19. They have worked around the clock, 7 days a week, to reduce infection rates and stabilize these facilities, all while being separated from their own families. They helped feed residents, they provided bedside care, and when residents became ill, they were there providing medical assistance our loved ones needed most. Their presence has made a difference for these vulnerable Canadians and their loved ones that will endure for months and years to come. Canadian Armed Forces and civilian healthcare professionals have worked tirelessly to improve conditions at these long-term care facilities. And our efforts paid off. As conditions at facilities have improved and staff have returned to duty, both Ontario and Quebec have worked with the Canadian Armed Forces to transition from facilities based on pre-established criteria. And starting today and over the coming days, Canadian Armed Forces members will begin to transition out of remaining long-term care facilities. But I want to be clear, the Canadian Armed Forces will not leave a facility until it is stable. This means we do not need to be replaced. Before leaving these facilities, they will again ensure that conditions are stable and that staff are well equipped to continue to meet their residents' needs. And our members in uniform have been sharing lessons learned and best practices with the Red Cross to help prepare them for their duties in long-term care facilities, helping our most vulnerable. In the coming days, Canadian Armed Forces members have deployed in these long-term care facilities. They will go into a 14-day isolation period so that they will be ready to resume normal duties, such as providing health care to Canadian Armed Forces members, conducting training, and participating in domestic and international operations. But we still will be there to help if there is another crisis. Canadian Armed Forces will continue to maintain a reserve of 10 augmented civilian care shifts, teams of medical and support personnel who will be ready to assist Quebec facilities in case the situation becomes critical again. These teams will be able to respond to any COVID-19 outbreak that civilian staff and provincial health authorities are unable to control on their own. Beyond that, the Canadian Armed Forces will be ready to respond in the event of natural disasters across Canada's, threats to Canada's safety and security, or a second wave of COVID-19 pandemic. And those who served in long-term care facilities, caring for our family members, our friends, and our loved ones deserve our thanks for their help in fighting COVID-19. They have put themselves in difficult situations to look after some of Canada's most vulnerable residents. In many ways, this has not been a standard operation for the Canadian Armed Forces, but this is exactly what the Canadian Armed Forces does. Our members in uniform have put Canadians' needs, health, and well-being ahead of their own. They put service before self, and every single time they have answered the call. And for that, they have once again earned the respect and admiration of a grateful nation. Merci beaucoup.
Thank you, Ministers. We'll now go to Mr. Conrad Sauvé, CEO of the Canadian Red Cross. On va maintenant passer à M. Conrad Sauvé, PDG de la Croix-Rouge canadienne.
Merci, Monsieur le ministre Sajjan, ministre Blair, ministre Rodriguez. La responsabilité de protéger les personnes les plus vulnérables pendant la crise est l'affaire de tous. Il est vraiment encourageant de constater la réaction des Canadiennes et des Canadiens qui ont offert de travailler en première ligne face à cette crise. L'appui financier du gouvernement du Canada continue de revêtir une importance cruciale pour soutenir cette intervention humanitaire collective. La Croix-Rouge canadienne est fière de prendre cet engagement qui permettra d'offrir un soutien continu aux résidents des CHSLD au Québec. COVID-19 pandemic continues to impact some of the most vulnerable members of our society, And sadly, this has been especially true for older Canadians. The responsibility to protect those most vulnerable during this crisis is a responsibility that we must all meet. It has been truly encouraging to see the response from Canadians who have stepped forward to work on the front lines of this crisis. The financial support provided by the Government of Canada continues to be instrumental in supporting this collective humanitarian response. The Canadian Red Cross welcomes this commitment to provide ongoing support to residents of the long-term care facilities in Quebec. The Canadian Red Cross is used to responding to increasingly complex disasters in Canada. From annual flooding in the east to devastating wildfires in the west, we have been growing our capacity to respond. This pandemic has required a response of an even greater scale. And we are scaling up our teams to build a humanitarian workforce to provide the necessary support in the long-term care homes in Quebec. Now, these are paid positions. I want to insist on that. We're recruiting for paid positions in support aid, site managers, health and safety, as well as administration. Those roles require a minimum of 1 month commitment with the opportunity to work over the summer for those who want. Now, this is a great opportunity for students looking for summer work, individuals who may be out of work temporarily due to COVID, or those just looking to make a difference this summer. You do not need to have a background in healthcare, just a desire to help. Donc, nous travaillons présentement à mobiliser des renforts, à soutenir constituer une force humanitaire qui pourra offrir un soutien essentiel dans les CHSLD au Québec. Il s'agit de postes rémunérés, dont les rôles suivants: aide de service, coordonnateur de site, conseiller en santé et sécurité et préposé à l'administration. Les candidats retenus seront appelés à travailler au cours de l'été et devront s'engager pour un mandat minimal de 1 mois. Il s'agit là d'une excellente occasion pour les étudiants qui cherchent un emploi d'été, les travailleurs qui ont perdu leur emploi en raison de la COVID-19 ou toute personne qui a envie de rendre service à sa communauté. L'expérience dans le domaine de la santé n'est pas nécessaire pour postuler, il suffit d'avoir envie d'aider. The health and safety of our teams and individuals we serve is extremely important. All Red Cross team members working in the long-term care facilities will receive training, equipment, and support, and we foster an environment that promotes the safety and well-being of the residents. The first teams totaling 150 people will deploy starting July 6th. That team has already been recruited and will be trained next week. More teams will follow in the subsequent weeks. Our initial focus will be in Montreal with the potential to expand across the Quebec if needed. Nous souhaitons encourager la population à se renseigner sur cette initiative ou à postuler en visitant notre site croixrouge.ca. Encore une fois, toutes les informations pour ceux qui seraient intéressés sur le site croixrouge.ca. Nous sommes impatients de continuer à travailler étroitement avec le gouvernement du Québec pour venir en aide aux résidents des CHSLD. Again, I would like to thank the Government of Canada for their ongoing support to the humanitarian response during this pandemic. Merci.
We'll now open the floor to questions. We'll start over the phone with 4 questions and a follow-up. Alors, on va commencer au téléphone avec 4 questions et une question de suivi. Opérateur.
Merci. Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser votre question. La première question est de Michel Lamache de TVA. Please proceed. Your line is open.
Oui, bonjour. Une question pour le lieutenant du Québec et pour Monsieur Sauvé. J'aimerais savoir ce qui vous permet de dire avec beaucoup d'assurance aujourd'hui qu'à la fin du mois de juillet, vous aurez 900 membres du personnel déployés dans les CHSLD comme vous semblez être en plein recrutement à ce moment-ci. Donc, si vous n'avez pas le personnel, qu'est-ce qui vous fait dire qu'on aura 900 personnes à la fin du mois de juillet?
Donc, c'est une campagne qu'on a commencée la semaine dernière, en fait, un peu plus d'une semaine et demie, et la réponse initiale est très favorable. Donc, on a créé un rythme de recrutement et on est sur ce rythme de recrutement-là. Donc, on est déjà avec le premier déploiement disponible. Et encore une fois, donc, les gens répondent bien et on va continuer à recruter. Donc, en ce moment, on atteint l'ensemble des objectifs qu'on s'est fixés à ce jour. Donc, il n'y a rien qui nous laisse croire qu'on n'atteindra pas ces chiffres à mesure qu'on avance. Yes. So we've started a campaign a little over a week ago of recruitment, and that campaign's going well. We have our first 150 recruited. They'll be trained next week. We've set ourselves some timelines in terms of the recruitment, and we're meeting all those timelines as we go. So we're confident to be able to achieve that. Of course, we're using this opportunity to, again, encourage those who want to join, and we'll be doing that as we go along, but we're already preparing the second group for the second week as we stand.
Je pense que M. Sauvé a répondu à la question.
En question de suivi, Michel?
Oui, celle-là pour vous, M. Rodriguez. Serait pas, voyant que la période de recrutement a lieu présentement, alors qu'on savait il y a quand même quelques semaines là, que les militaires se retiraient des CHSLD le 26 juin, voyant qu'il y a de l'incertitude, même si vous vous montrez confiant, on n'est pas certain qu'on aura ces centaines de personnes sur le terrain à la fin du mois de juillet. C'est pas beaucoup plus simple de garder les forces militaires dans les CHSLD, M. Rodriguez?
Bien, on a été clair et on l'est tout aussi clair aujourd'hui. Nos hommes, nos femmes des Forces armées ont fait un travail extraordinaire et ils ont travaillé dans un total de 47 établissements. Ils sont encore dans quelques-uns d'entre eux et l'engagement, c'est qu'ils ne quitteront pas tant que cet établissement ne sera pas passé au vert. Donc, qu'il va être vraiment là, sous contrôle et que les choses vont bien. Donc, pendant ce temps-là, pendant qu'il y a des discussions qui sont très positives par ailleurs avec Québec, le travail se fait par nos militaires dans ces CHSLD-là en collaboration avec le personnel local et ainsi de suite. Donc, comme je le disais tantôt, le ministre Sajjan, nos soldats n'ont pas à être remplacés. Ils quittent uniquement lorsque la situation est stable, lorsque l'établissement est passé au vert, donc lorsque le travail le plus urgent est fait. Et maintenant, on peut faire cette transition vers du personnel civil en toute confiance.
Opérateur, prochaine question.
Merci. Thank you. The next question, la question suivante est de Marie Vastel du Devoir. La parole est à vous. Please proceed.
Oui, bonjour. I'm not sure if my question will be better answered by Minister Sajjan or Minister Blair, so whichever of you has the information, I would be grateful if you can answer. Prime Minister Trudeau mentioned this morning that some members of the Canadian Armed Forces will stay in 4 CHSLDs for a few more days. I'd like to know which CHSLDs and what date do you estimate that they will leave? How many days are we talking about?
Well, that's the question. First of all, I just want to make it clear, we're not actually putting a date on the facilities that we're leaving. The 4 facilities will get, I don't have the exact names of the facilities in front of me here. I can get that to you. But our focus is making sure that the facilities have met our criteria and they are stable before we leave. So we're not putting a date on it. So we got, based on our own experience, the military has some idea how long this may take, but we're not putting an actual date on this. We want to make sure that we make it very clear that we will only leave once these facilities are stable.
Suivi, Marie?
Marie, comme ce fut le cas aussi dans tous les autres CHSLD où l'armée fut présente.
Merci. Maybe as a follow-up and then my second question. So, Minister Sajjan, you said there's no specific date, but can you share the ballpark with us? And then I think Minister Blair mentioned that this Red Cross recruitment operation would be funded in part by the $100 million that was given by the federal government. So is there more money being put forward by the federal government? If so, how much? And how much do you estimate, maybe for M. Sauvé, combien vous croyez que ça va coûter toute cette opération-là là, d'ici la mi-septembre?
To answer your question regarding the timeline, a lot of the work that's being done is really literally from care facility to care facility. So the details of how long it will take, it's difficult to answer by care facility. But based on our experience and how I've been briefed is, because of the great work that our Canadian Armed Forces personnel were doing, on average, we were looking at, if we went into a facility that was critical, it would take about 19 to 21 days based on the criteria that we have to make it become stable. Whether it's the infection rate, it's the people returning to work, the access to PPE. So all this was a part of it. So on average, it's been about 19 to 21 days or so. But each facility has been different, and I don't have the exact timeline for those facilities. But one thing I can assure you, because of our people, that the work that they have done, they have learned and they've used their lessons, passed those on, but more importantly, been able to move very quickly to make those facilities stable, because ultimately making them stable is exactly what our parents and grandparents need at this difficult time.
Au sujet du financement, Marie, pour être clair, l'argent qui a été fourni par le gouvernement du Canada à la Croix-Rouge suffit à couvrir l'ensemble des opérations de la Croix-Rouge dans ce cas-ci.
Opérateur, prochaine question.
Merci. Thank you. La prochaine question est de Catherine Lévesque de la Presse canadienne. La parole est à vous. Please proceed.
Oui, bonjour, messieurs. My first question is for Minister Sajjan. You mentioned there will still be teams from the Canadian Armed Forces helping in case there's a crisis. We're talking about a total of 70 people. I was wondering, why do you consider that is sufficient to help out? And I was wondering, what is the rest of the medical personnel going to be doing?
The teams that will be on standby, we do have 10 shifts that will be made available. Right now, based on our information, that there are no critical facilities that remain. But more importantly, just in case things change, we wanted to make sure we gave confidence to the people of Quebec that if things were to become critical once again, that we do have the resources to be able to search. And that's why the military has planned this in this way. So the work that's being done is based on the lessons that have been learned. But I can assure you, all the facilities that were currently read will be made stable before we depart. But in case the situation with COVID is so fluid, but we wanted to make sure that there was enough resource there if something becomes critical. But obviously, the great work that's been done by the Red Cross at the federal level, and especially the provincial government, is to making sure that we don't get into that situation.
En suivi, Catherine?
Oui, et mon autre question, c'est pour M. Sauvé. Le critère qui est indiqué sur votre site pour le recrutement, c'est qu'il y a un minimum que les personnes intéressées soient disponibles pour un minimum de 4 semaines. Pourquoi ne pas avoir étendu ce critère-là, considérant que c'est en plein été, qu'il y a la PCU, qu'il fait beau, il fait chaud, bref, il y a toutes sortes de raisons qui nous feraient peut-être croire que vous pourriez avoir de la difficulté à avoir un total de 900 personnes, et ce jusqu'au 15 septembre. Pourquoi ne pas avoir élargi ces critères-là?
Ben, c'est-à-dire que c'est un minimum. Et comme je le disais, c'est pas un maximum. Donc, des personnes qui seraient intéressées à rester l'été, en fait, sont bienvenues. C'est simplement le minimum d'un mois. C'est pour séparer ça du travail bénévole, de l'engagement, parce que c'est un travail rémunéré. Donc, il y a une formation aussi attachée à ça. Donc, c'est pour ça qu'on a mis le minimum de 1 mois, mais il n'y a pas de maximum dans ce cas-ci. Donc, encore une fois, des gens qui voudront rester plus longtemps sont le bienvenu aussi.
Operator, next question.
Thank you. Merci. The next question is from Jamie Pachakumskum of APTN News. Please proceed. La parole est à vous.
Thank you. My question is for Minister Blair. Chantal Moore's home community has asked for an inquiry in her death, and they would like a say. They've requested to have a say in approving the independent investigators. What would you say to their request to have a say in choosing, approving investigators?
Thank you very much for the question. I had the opportunity to speak this morning to Dr. Judith Sayers, who is the president of the New Chalnouf Tribal Council, Chantal Moore's community. We did discuss the tragedy of her death. And as you know, that particular death occurred in a municipality under provincial jurisdiction. We talked about the current independent investigation that's being conducted by a police services from Quebec in there, which is independent of the Edmundston police service where that event took place. We did talk also about a number of concerns that her tribal council has and a way forward. And I did commit to her that we would continue to work together to address their concerns and to ensure that there was a comprehensive investigation of that case being done by an independent police agency.
Follow up?
Just in reference to my first question, what would you say to communities who want a say in approving it? It's because there are no Indigenous people involved in these investigations.
I think it's critically important to involve Indigenous leadership in these discussions. And just for example, as we have already indicated, it is our intention to bring forward a new legislative framework for Indigenous policing right across Canada. But we also propose that would be co-produced with Indigenous communities and Indigenous leadership. The importance of co-production of such a new framework, it absolutely is essential that Indigenous voices and leadership inform all of those discussions and decisions. I have reached out to the National Chief of the Assembly First Nations, spoken to many of the regional chiefs, a number of Grand Chiefs across the country. There is a very strong desire for collaboration and consultation in that work, and we're absolutely committed to moving forward as quickly as possible, but to ensure that those Indigenous voices in leadership across the country provide inform all decisions with respect to how their communities are to be policed. And so I believe very strongly in that very collaborative and Indigenous voice informed approach.
We'll now go to questions in the room. On va maintenant aller aux questions dans la salle. First question.
Hi there, Max Paris from CBC News. This is either for Monsieur Sauvé or Minister Blair. The Red Cross is going to provide 150 people by July 6th, and then eventually an additional 750 by the end of July. They'll start September. They'll stay until September 15th, when Quebec's new orderlies presumably will be ready to work in the CHSL days. How confident are you this is going to be sufficient?
Well, we'll see. I mean, this is what's been asked of us, so we're answering the need. But my sense it is. I think we're seeing very much a stabilization of the situation in the long-term care facilities. So again, we can't control quite the future, but I mean, we've asked to deliver on this amount, and we're confident we can do that.
Okay, Minister Blair, anything to say?
Yeah, if I may add, we've been working very close with government, and I spoke as earlier this afternoon to Minister Harjit Sajjan of the Quebec government. My officials, along with the Ministry of Health and Social Services in Quebec, are in very close collaboration. We have from the outset. And as you'll recall, in April, when Quebec was facing a crisis in their long-term care facilities and nursing homes, they asked for help. And we responded to that crisis with the resources and deployed the Canadian Armed Forces into those facilities. They have done extraordinary work, and it's been very collaborative between the Quebec government and the Canadian Armed Forces and our government in responding to a critical crisis situation. And as we've indicated, there is strong and growing evidence that crisis situation has been brought under control, but there's still a great deal of work to do. And so working very closely in response to an ongoing request for continued assistance from the Quebec government, we have worked with the Canadian Red Cross to expand their operations in Quebec, and we have great confidence in the work of the Canadian Red Cross. We've worked with them, and they have been there for Canadians at so many critical incidents and disasters across the country with fires and floods and other crisis situations. They've been there for us during this pandemic. We have great confidence in their ability to deliver what we have asked of them. And as well, we're going to continue to work very closely with the province of Quebec. I want Quebecers, the people of Quebec, to understand that we, the Quebec government and the Canadian Red Cross, remain absolutely committed to the health and safety of those citizens And we all express our gratitude and appreciation to the extraordinary work that the Canadian Armed Forces have done. And so going forward, we'll continue to communicate on a daily basis between our officials to make sure that we're there to respond to the needs of the people in Quebec.
As a follow-up, Max?
Yeah, this one is either for Minister Sajjan or perhaps General Vance. I'm not sure if he's going to be answering questions today, but since the deployment of the CAF to the LTCs in Quebec and Ontario, 55 have come down with COVID. Could the troops have been better protected, and if so, how?
Yeah, thanks for the question. So, yeah, 55 of which I think all but 4 have now recovered through a period of isolation, and thank heavens none of them had to be hospitalized. You asked a question about could we better prepare? I think that as we went into those long-term care facilities, we brought with us the best knowledge that we could, but we didn't have local knowledge of the facilities themselves. And so as we blended with the staff that existed, as we understood the facilities and how they worked, I think there was a contact with the virus. There was also contact with the virus in the facilities that we were living in. We were sharing hotel space with other emergency workers and so on. So the virus is, it's insidious and easily contracted. For the number of troops we had deployed, I think they did a great job in protecting themselves. But they went in with the PPE and the procedures that would be used in hospitals. But remember that lots of those troops that went in there were not experts in infectious environments. And so we're learning as they went.
Do you have any plan on how you would protect yourself in the future, or how you would protect your soldiers in the future?
Well, I think we would do what we did this time, is abide by medical advice. We believe that some of those troops that were determined to be infected had been asymptomatic before the operation started. So a testing regime is going to be really critical going forward. We now have an independent, domestic to the armed forces testing capacity, which we didn't have at the beginning of this, so now we do. Find them earlier would be part of that way to protect them. And then the PPE and any advances in PPE we would take advantage of. And then, of course, there would be a vaccine, the ultimate protection.
General Vance, Mackenzie Gray from CTV. I've got a question for you as well. Obviously, the Red Cross are going in, and as Minister Sajjan said, they do good work, but your organization has been prepared for instances like this in the past through the training that they've done, and now have gained substantial training through the process of being in the long-term care homes. The leader of the bloc, Yves Poisson-Blanchette, said, "I cannot think of an organization that is so well prepared to be able to be agile and nimble to be able to deal with these things." So I'm wondering why, from an organizational and an operational perspective, it makes sense to pull the troops out now, considering we're going to be sending civilians in to do the work that the military has been doing up to this point.
Yeah, it's a great question. I know it's on people's minds. The simple fact is that the armed forces is responding to a request for assistance, and the armed forces typically responds in the national interest when it's a situation of dire emergency or crisis beyond the control of those whose normal job it is. And so in this case, that was clearly the case, and both provinces requested the support of the armed forces, particularly in Quebec, and the numbers they did. So the armed forces' purpose in this regard was to support where the civil authorities and those whose normal job this is were incapable of responding. Our job is to then restore that to stability and then leave it. The same we would do for a forest fire or a flood. We are there for the crisis protection and urgency phase. And we've committed, in this case, to make it stable. I think it's quite appropriate, in fact, and you heard the Minister of Defense say, there's not really a gap. We've stabilized it, and in many cases, some of these facilities are stronger and more resilient than they were pre-COVID because they now have new infection control measures in place. And so that, the period of time from being stable to being more resilient as a function of the Quebec plan is not a period of time for the armed forces to be continuing to engage. The crisis is over. And I'll tell you, we've got our eye very keenly on potential for second wave. We've got to reopen training in the armed forces to ensure, and we can't train without our own medical branch there to support our training. The medical branch itself has to train and continue to be professionally proficient. And they've come across the country and they've been hard at it since April and haven't seen their families. And so we take all that together. If the armed forces are needed there, the armed forces will be there. And at this juncture, that killing crisis is abating, and so it's time for us to get back to the business at hand.
Mr. Sauvé wants to take it? Sure.
Just maybe put this response in context for the Red Cross. This is more a continuity for us. Remember that the Red Cross, we've deployed in cholera epidemics, in Ebola epidemics, so we have a lot of experience. And we are presently, we've helped out some 51 institutions in Quebec in long-term care and others in terms of their epidemic control. So we're already there. We're also helping with the recruitment in a number of them. This is aside this operation, so we're present. And we actually participated in training, doing part of the training in terms of epidemic to the military. So we're already doing the training, the recruitment, and so this is continuity for us. This is not an environment that is foreign to us at all. We're already present. So this fits right into the continuity of our operation.
As a follow-up. Yeah, General Vance, as a follow-up, obviously there's been a large conversation in the country recently about systemic racism. There's been conversations about the RCMP. Do you think that's an issue in the Canadian Armed Forces? And specifically, can you point to a policy that you think promotes systemic racism within the forces?
Yeah, thanks for that question. I can assure you that the Deputy Minister and I will be speaking publicly about plans moving forward that both recognize the fact that systemic racism and systemic other challenges to maintaining diversity and good, solid teams in the armed forces exist in the armed forces. We do not deny it, and in fact, we are battling a number of the challenges that would harm the team setting that is the armed forces. I can point to many reasons why the armed forces and how it manifests itself in terms of racism or extremism or sexism or any number of isms. It's all bad, and I'll tell you why it's bad. And I'll tell you how we got there. It's bad because we exist as a team of teams. We're a system of teams. Teams work when you trust each other, when you feel confident in each other, when each individual feels confident. Those teams are now being asked to do things that are different. Warfare is changing. And warfare demands those teams be far more diverse in their thinking, far more diverse in their education, and a way wider skill set needed to be able to bring to bear the creativity to be thinking outside of that box so that opposing forces, adversaries, don't get the better of you. Warfare has changed a great deal. And it's critical that those teams are confident in each other and in each individual. The armed forces can certainly be accused of being very tribal. And over the many, many generations, we used to recruit locally, we used to train locally, and there was a sense that in a bygone era, that you could only trust those who were like you. That is deeply rooted in the armed forces. But we know better now. We know, having deployed on operations, we know, I know personally, with my own minister, having deployed on operations with a diverse team, we are far more powerful, far more skilled. And the challenge for us is to create confidence, to remove the barriers, and so that people can come in and be confident. and to champion the fact that all have a valuable part to play. We have put in place a number of strategies and efforts. Operation Honor was a start to remove systemic barriers and eliminate a toxic environment in the forces. We're about to launch a strategy that will further Operation Honor, and that strategy is a culture change strategy, first of its kind that I know of in the armed forces. To do a culture change strategy like that took 2 years of effort of research to be able to put it out, and we'll get it out soon. That culture change strategy will help inform the other aspects of cultural change we need to do in the armed forces that ensures that people from the outset are encouraged and feel welcome in the armed forces, but more importantly, are genuinely valued for what they bring to bear. And so it's about the job. It's about how well you do the job, and the nature of conflict today and the people we need in the armed forces. We need a whole massively diverse range of skill sets from a diverse group. Men, women, whatever your creed, your gender, or your orientation. It doesn't matter. What matters is the job and that you're able to form teams. There are those who I believe would see some virtue in the homogeneity of the teams of bygone years. Those are not the people I'm trying to recruit, and those are not the people who are going to be fighting the next wars for Canada. Those are people who are speaking with bygone voices about bygone warfare, and it doesn't matter and it doesn't exist anymore. What matters and what exists are a valuable need to reflect the society that we fight and defend, and value those people who will be part of those teams, who will be able to bring to bear the fighting capacity of the armed forces in future conflict. And that means teams increasingly diverse by necessity. So we're on it, and you'll hear more from us later. Thank you.
Just to add to that, I wanted to just add on the Chief's comments here. The current situation that we see almost around the world because of Black Lives Matter, and it took a death to bring this out to so many people around the world. And our Prime Minister has been very clear on this and very strong about talking about systemic racism in Canada and the systemic racism that then eventually is in our institutions. But in terms of national defense and the Canadian Armed Forces and national defense and CSE, which I'm responsible for, we started these conversations way back. And it takes leadership to make a change, but not leadership of one. It takes a leadership of an entire team to be able to do so, and we have the right leadership to do that. It's because of those discussions early on that we're looking to identify and deal with when something comes up and deal with it aggressively. But more importantly, how do you proactively look at things and so you can make those changes to start dismantling the systemic racism? And that's what we're doing inside the National Defense, and there will be more work that will be coming done on this. And as you know, our Prime Minister has been very clear what our stance as a government is on this.
Thank you. We'll now go over the phone. On va maintenant aller au téléphone. Opérateur.
Merci. Thank you. La prochaine question est d'Émilie Bergeron de l'agence Q&A. La parole est à vous. Please proceed.
Oui, bonjour. J'aimerais juste clarifier, peut-être, Monsieur Sauvé, au niveau du recrutement, on comprend qu'il va y avoir une première cohorte de 150 qui sont déjà recrutés d'ici à partir du 6 juillet. Pourquoi ce n'a pas été possible d'avoir ces personnes-là déjà formées et déjà présentes à partir d'aujourd'hui? Du côté des relations médias de la Croix-Rouge, on nous dit que cette date-là du 6 juillet a été fixée par les gouvernements, donc fédéral et provincial. Est-ce que c'est exact? Expliquez-nous un peu comment ça s'est passé.
Bien, à partir du moment où on nous a donné le mandat, en fait, on a commencé la période de recrutement. Donc, on a commencé, je pense qu'il y a un peu plus d'une semaine, ce recrutement-là. Et donc, on est sur sur les échéanciers qu'on s'est donnés. Et c'est pour ça qu'on va être prêt le 6 juillet avec la première cohorte qui est recrutée en ce moment, qui va être formée. Évidemment, on veut se donner le temps à chaque fois de former les gens correctement pour cette situation-là. Donc, on est sur ces échéanciers-là. Comme je le disais plus tôt, on est quand même impliqué, la Croix-Rouge, depuis plusieurs mois dans les centres de longue durée déjà, à Montréal, surtout en support aux CIUS de l'Ouest. mais aussi dans les autres établissements. Mais à partir du moment où on a eu ce mandat additionnel, eh bien, on a commencé le programme avec des échéanciers. Et évidemment, on recrute en ce moment, donc ça va bien, mais on encourage ceux qui voudraient donner un mois ou plus à le faire en nous contactant sur notre site.
En suivi, Émilie?
Oui, merci. En fait, j'essaie de comprendre, dans le fond, vous avez reçu le mandat il y a une semaine et demie quand vous avez lancé la campagne, parce que quand même, il y avait des discussions depuis des semaines avant sur l'implication de la Croix-Rouge, et peut-être clarifier quand vous dites qu'il y a déjà des gens de la Croix-Rouge, on est déjà impliqués depuis le début, pour que les gens comprennent combien environ de personnes étaient déjà impliquées de la Croix-Rouge et sont là en ce moment.
C'est un mandat différent, mais c'est un mandat avec le CIUS de l'Ouest. Donc, ça fait, je pense, presque 3 mois, en fait, qu'on est dans le processus de recrutement. On a fait la formation aussi. Donc, je mentionnais tout à l'heure, c'est nous qui avons fait aussi la formation des 1200 militaires, en fait, sur un des volets de santé. Donc, on est présent dans ce contexte-là. Mais par rapport à ce mandat-ci, évidemment, je ne peux pas répondre pour le gouvernement, là, mais ça fait un peu plus d'une semaine qu'il y a une entente pour déployer la Croix-Rouge. Et évidemment, on est dans le processus dont on se parle.
Prendre une prochaine question. On va prendre une dernière question au téléphone. So we'll take your last questions on the phone, opérateur.
Thank you, merci. La dernière question est de Fanny Bichère de Radio-Canada. The last question is yours. Your line is open. Ms. Bichère.
En ce moment, on a un départ de presque tous les militaires aujourd'hui, sauf quelques dizaines. Il y a seulement 150 employés de la Croix-Rouge qui vont devenir disponibles à partir du 6 juillet. Donc, on parle de transition progressive, mais moi, ce que je vois, c'est un passage à vide, là, essentiellement, pendant une dizaine de jours. Est-ce que cette transition-là elle a pas été un petit peu mal arrimée? Là? Je ne sais pas, j'essaie de comprendre comment on a pensé ça.
Pas du tout. Rappelons-nous que nos forces armées ont été dans 47 établissements au total et qu'ils ont fait la job. Là. Ils ont quitté uniquement lorsque le travail était fait. Maintenant, ils sont encore dans 4 autres et l'engagement est le même, qui est celui uniquement de quitter lorsque le travail est fait. Donc, ils n'ont pas besoin d'être remplacés. On n'est pas en train de dire « Oh mon Dieu, il faut que ces gens-là soient remplacés. Vite, vite, la Croix-Rouge. » Ce qu'on dit, c'est qu'ils ont fait le travail dans ces 47 établissements. Ils sont en train de le finir dans d'autres établissements. Ils vont quitter uniquement lorsque la situation est stable et lorsque l'établissement est passé au vert. Et cette situation d'urgence qui existait n'est plus là, ce qui nous permet de transiter du travail des forces armées au travail de civils, en l'occurrence la Croix-Rouge.
Parfait, merci. Deuxième question irait à M.
Désolé, on va juste prendre la question en anglais.
What I'm saying is that our armed forces did the job. They were in 47 how do you call that long-term facilities. They're remaining in 4. They only left when the job was done. When you turn to green, actually they're in other 4, and they will only leave when the job is done once it's turned to green. So they don't have to be replaced, as some people are saying. They will not be replaced. The job will be done at the moment they leave. And this allows us a transition from this emergency work and very important work that was done by our soldiers, and it allows to transition to work done by the Red Cross.
Prochaine question, Fanny.
Oui, pour M. Sauvé, là, je comprends ce que M. Rodriguez dit en disant qu'on n'est plus dans une situation d'urgence comme elle l'était avant. Par contre, on considère quand même qu'on a besoin de 900 personnes pour remplacer le millier de militaires. C'est ça qu'on vise pour l'été. Je voulais savoir, M. Sauvé, est-ce que vous sentez une grande pression de prendre la relève de cette manière-là, alors que pendant 10 jours, on va avoir beaucoup moins de personnes? Est-ce que c'est des transitions qui sont vraiment dans des conditions que vous appréhendez ou que vous considérez comme étant satisfaisantes? Je veux savoir comment vous appréhendez ce début d'intervention-là.
En ce moment, non, mais en fait, on travaille de très près avec, évidemment, tout ça avec le gouvernement du Québec, avec le ministère de la Santé et des Services sociaux, pour identifier les sites où on devra rajouter du personnel. Donc, on est en lien avec ça. Et tout ça se fait, évidemment, avec le plan de croissance de nos effectifs durant le prochain mois. Donc, on est dans ce processus-là en ce moment.
Mais vos impressions, vous sentez comment? Là?
En anglais, s'il vous plaît.
Oui. Donc, la même chose en anglais. Yes, so we're in close contact with the health ministry and the regional health authorities in terms of looking at the sites we will be required to replace, and this is on the basis, this is within the timelines as we build up our capacity. So we're in this process right now, and there's not an additional pressure on us right now beyond the dates we're looking at. Donc, à ce stade-ci, pardon, là, c'était en anglais, l'autre.
Non, ben, c'est ce qui conclut notre conférence de presse. Donc, this concludes our press conference. Thank you all for being here.